Assalamualaikum. Good afternoon. My name is Dr. Shah Jumaat bin Muhammad Yusof. I am a plastic surgeon, currently practicing at UiTM Private Specialist Center. I'm also the head of plastic surgery at UiTM Faculty of Medicine. I think today I'll be talking a little bit about liposuction. I think it is a common procedure, relatively common procedure that a lot of people are currently quite interested in. There also has been a lot of incidents or in the social media or in the media as a whole about the complications of liposuction. So I thought I'll take this opportunity to at least tell everyone a little bit about what liposuction is, the risks, the benefits, and also the complications. What liposuction essentially is, it's a process where we remove the fat from parts of the body via a system that essentially sucks the fat out. Okay. Common places for liposuction would be generally the abdomen, the thigh, and anywhere else where you have depositions of fat under the skin. The process should be done by someone who is qualified, and people who are qualified generally are plastic surgeons in this country. You have to make sure that the person who performs the procedure on you is adequately qualified, and one of the ways is of course to check the surgeon on the National Specialist Registry website. Liposuction in generally is performed in a hospital setting. There are many ways of doing it. However, there are many machines that can do it, but the method is essentially the same. Small incisions are made over the areas that require the fat to be removed. It was about half a centimeter incision for us to put in the cannula to remove the fat. It can be done both under a local anesthesia or a general anesthesia. The volume that needs to be removed can vary according to the person. Hence, proper consultation is important. Liposuction, the important thing about liposuction is it may not be the procedure of choice for everyone. Liposuction can only remove the fat. However, if someone has excess skin, the liposuction machine will not be able to remove that. Hence, especially in the abdomen, a lot of people would come to me and ask, I want a liposuction. However, after being assessed, you realize that the patient also has excess skin. Hence, the liposuction alone would not benefit the person. The person would need also an operation to remove the skin. That's where the tummy tuck comes in. But the process of tummy tuck or abdominoplasty will be a topic for another day. Patients who would be suitable for liposuction would come under a few categories. Number one, we have to ensure that the patient is healthy for the procedure. So first, the patient has to be healthy. The general medical condition should be well controlled. If the patient has diabetes, has hypertension, this condition should be well controlled. However, when it comes to the procedure itself, liposuction is essentially indicated for small areas of resistant fat. That is the ideal patient for liposuction. Removing a large volume of fat from someone, or what we call a large volume liposuction, is not for everybody. The reason being, as I said earlier, is if you remove the fat alone, you have the skin that sags down. So patients who only has deposition of fat and not excess skin, these are patients who are suitable for liposuction. And secondly, the patient has to be medically fit. That's why a proper assessment of the patient is important. Not only where the fat deposits are, also where if the patient is fit to undergo the surgery itself. Nothing comes without its risk. So now I guess I will discuss what are the risks of liposuction. The risk of liposuction can be divided into two. The first one is the risk of the anesthetic itself. Liposuctions can be performed under a general anesthetic or a local anesthetic. Which mechanism or which type of anesthesia that would be performed will be discussed with the patients. Some patients, they prefer to have it under general anesthetic, whereas some people, they prefer local anesthetic. However, the input of the medical practitioner is also vital. Small volumes of fat can be removed under local anesthesia safely. What do I say a small volume of fat? It's something usually less than 10% of total body weight. So i.e. maybe less than 6 liters can be considered low volume liposuction. Hence this can be done under local anesthesia if the patient requires. Okay, now with regards to liposuction, I've mentioned the complications of liposuction can be divided into one, the complications of anesthesia, second, the complications of the procedure itself. So with regards to complications of the anesthesia, if it's done under local anesthetic, the complications can be, the first one, increased absorption of the anesthesia. However, it's generally relatively safe, the procedure itself, because if it's done in a proper setting, the patient would be monitored on a continuous basis. Hence, if there is any complications, we should be able to detect it earlier. That's with regards to the complication of the anesthesia. However, now with regards to the complication itself, liposuctions, of course you have heard that liposuctions can be fatal. Yeah, there is no doubt. Hence, we always emphasize that the person performing the procedure should be someone who's qualified. So liposuction, the complications would be, number one, could be bruising. It's a relatively common complication that can occur over the skin that has been liposucked. However, the bruising would usually resolve after 2 to 3 weeks. The second complication could be, of course, an infection can come in. However, the incidence of infection is relatively low if it's done in a proper aseptic technique. The other complications are asymmetry, asymmetry of the skin, which can occur. However, again, there are ways that we can correct this. The major complications that can occur, of course, we say is it can be fatal. However, the incidence, thankfully, is relatively very low. But again, the person performing it has to be someone who is well qualified. That's why we always emphasize that the person performing the procedure should be someone who's qualified in doing it. There are also incidences where this would be in the media, where patients they die due to damage to internal organs. It can occur, however, again, the person performing it, if it's well qualified, hopefully this incidence is very low. Other incidents that can occur are fat embolism, that is pieces of fat enter the bloodstream and goes to the lung. However, again, we can detect this early, and you would be monitored on a very close basis when the procedure is done and also after the procedure. So generally speaking, liposuction, if performed in a proper setting, is a relatively safe procedure if it's done in the right manner, the right setting, and for the right patient. Now, patients who would be considering liposuction, I would advise them to visit your friendly plastic surgeon in the neighborhood. You can have a consultation with the surgeon, and he will in fact tell you if you are a suitable candidate, and if you have any questions, he would be able to answer them. Ideally, if someone who has liposuction, the first thing, of course, is we would advise that you try we would advise that you try and maintain your weight, which means your weight should plateau. If you're on a regime to lose weight healthily, your weight loss should plateau. Okay, if you're still on your weight is still yo-yoing up and down, maybe you're not a suitable candidate just yet. The reason being is because we may remove the fat, but then if you're not on a healthy diet, if not you're not on a proper exercise regime, you may still gain back that weight, so it's not permanent. Hence, patients who require it would be advised to have at least your weight should be plateaued. Liposuction, the procedure varies from patient to patient. The difference is because each patient is different. Some may require a bit more to be removed, some require a bit less. Hence, so the duration of the procedure can vary anything from between 1 hour to 4 to 5 hours, depends on how much we are removing. Secondly is it can be done as a daycare, which means you can come in the morning of the procedure, have it done and go home in the evening. Patients who are suitable for daycare should be patients who are fit, and the amount liposucked or removed should be a small volume liposuction. These are patients that are suitable for daycare. However, patients who require a large volume liposuction, we would usually admit them for a couple of days. There are questions or people have asked me before if I've had a liposuction already, can I have the procedure again? There's no contraindication. Yes, you can have it again, but as I said earlier, ideally, if your weight should be plateaued when we do the procedure itself, and once the procedure is done, you should actually try to maintain your weight and to at least prevent from gaining excess fat. But yes, it can be done for the second time.